Hello. Hello. How are y'all? Good afternoon. I appreciate y'all coming. I want to tell you it is an honor to be speaking in front of y'all today. Um, what we're going to talk about today, hopefully I'll get y'all out of here a little early, hopefully. What we're going to be talking about today is setting and managing expectations for leaders and employees. So every person has expectations all the time. Y'all have expectations for coming to this class. You say, okay, maybe I'll learn something new. Maybe I'll find something that I can take back home with me. I have expectations for this class. I expect y'all to get up when I ask you to jump around. I'm kidding. I'm kidding. Never would do that to y'all. But we all have expectations. And unfortunately, as leaders and as people, we have expectations of ourselves that we don't really ever voice to anyone else. We just expect our employees to understand, don't kill anybody. Not today. Don't do wasteful things. If you don't have an order, don't do a patient. The thing is, they don't know that. They for real don't know that. You have to set the expectations for your employees or they will never trust you fully and understand what you're expecting of them. So every time they see you, every time you walk through the department, you walk through and they're like, oh, what is she coming to gripe at us again? Instead of, oh my God, there's Kelsey. I need to tell her what I did last weekend. And so when you start looking at statistics, now it's not going to work. Awesome. See, expectations. You expect, I came in here early to see if it worked. I'm sorry, I have candy in my mouth, but that makes it easier. Oh, look at that. Yay. Okay, so looking at statistics, it is 52% of millennials and Gen Zs are likely to consider changing jobs into 2023. One is for money. The other is for these two generations are different. They're much different than the boomers. They're much different than Gen X. We all came through and we're like, pull up your pants, let's get to work. These are much more coddled. And you have to explain to them, okay, I understand what's going on. I know it's busy. Now let's regroup, let's focus, let's take it one bite at a time. Because I can tell you that 90% of my people are Gen Z and millennials. I've had 2 quit in 6 years, ever. And it was because they were ready to move on, not because they didn't like the environment. I try to teach all of my employees literally come to me with anything all the time. Their expectations of me will be met for them. They come in, they're like, hey, Kelsey, you know, my daughter just had appendix burst. I need 3 months off. Go for it. Go. And I know that's not an easy thing for employees, other employees to see and be like, oh my God, you're giving her preferential treatment. I would do it for you. I would do it for you. If your child is if something happens, I am willing to do this for you. However, I want you to meet my expectations. My expectations for you, you're going to come to work on time. You are going to perform these exams and you're going to look at the order every single time. Now, when they don't, because they don't, especially orders, when they come to me, it's not a death sentence. I'm not out to ruin anyone's lives, ever. So when you're coming into my office, they're not scared, oh my God, I'm going to lose my job. They're like, okay, what's the consequences for not meeting that expectation? And so we have to understand what our expectations are. As leaders, you have to really self-reflect and understand what's important for you. And you have to sit there and go, okay, I don't care if my employees sit when they don't have anything to do. They can sit. It's fine. When I roll through there, I'm not looking, seeing who's sitting down, seeing if the papers are picked up, if they're doing things. I'm going, okay, I believe you. I figure y'all are doing what you're supposed to be doing. There has been no complaints. So you have to give them the expectations that I understand sometimes we're not all productive. I'm not always productive. I sit in my office sometimes, scroll through TikTok. I mean, we're people. That's what we do. And so when you're setting the expectations, you need to be extremely clear about what is okay and what isn't for you before you go and talk to your employees about what the expectations are. They have to be extremely clear and they have to make sense. If they don't make sense, they don't understand why they're doing it. You're going to get buy-in when you say, I need you to do this because this is the reason why I'm on you about this. I need you to show up to these daily huddles because this is what I'm getting graded on. This is what y'all are getting graded on. And then they're like, oh, okay. And I guarantee you, you will have so much employee buy-in if you just explain yourself. And I know, especially as leaders, we have a special fight or flight response. And what I mean by that is when things go down, they turn and they look at you. All of us in this room has had somebody turn and look at you and go, what do we do? What do we do? And so you have to be the one that understands your department, understands, and will be willing to step in front and go, you know what? I got y'all. This is what you're going to do. Every time we have some sort of mass casualty or something, I work really, really close with Dow Chemical, things like that. Things explode all the time. We have mass events all the time, which is just a gas leak, but 45 people come because they thought it was a gas leak. And so I will go in there and I'm their transporter. I have not taken an x-ray in many, many years, but I can be your transporter. I have not taken a CT in slightly shorter amount of time, but I can be your transporter. I can get that patient on the table. I can get them off. I can get them prioritized for you. But they see you out there in the middle, willing to help, willing to roll up your sleeves. They are going to expect that every single time. I really messed something up now. Oh, they're going to expect that from you, and they are going to give you 110%. They're going to be the ones right behind you going, let's go, let's do this. I know you got me. So what I would do most often is do one-on-one discussions with all your employees. I understand that I work at a podunk hospital, that I have 60 employees. I can get to know them individually very quickly. But what I would suggest in bigger hospitals is get to know your managers, get to know your leads. Sit there and I mean, go out to drinks with them, talk to them, understand what's important to them. And then when you come through, like I come through my departments, I roll through my departments all day long and I'm like, 30-second dance party. And they just start dancing with me and then I wander off. I have nothing to say. I just wander off and they're like, you're so awesome. You're so cool. And I have other departments coming up. Hey, our leader just left. Can you take us over? Hey, I heard you're really awesome to work for. Can you take us over? It's not a party all the time, but it's a party most of the time because that's what people want. That's what your employees want. They don't want to sit there and be hounded every day. Well, this one, our turnaround time for ER PTs are supposed to be 45 minutes. If I came in every week and said, okay, your turnaround time is 48 minutes, what do you plan to do about it? Who wants to see me? I don't want to see me. It is what it is. And you have to let your employees fix your flow for you. You have to show them that it's important. This is why it's important. You have to do this. And when they know you one-on-one and they know that your son at 16 wrecked his car and didn't tell you, they're more willing to tell you the problem that they are having. I accidentally hit the button and quenched it. Am I going to get fired for that? There are so many people who wander around every day. No, it was 100% an accident. It really was. She was sobbing on the floor. It was, the alarm was going off in the middle of the night. We've had so much issues with the MRI machine, and no, you were 100% correct, because that's how most people would react. They'd be like, oh no, you gone. My MRI tech had somebody come in with BBs in their pockets. Did he get fired? No. Did he get yelled at? Quite a bit. But you have to say, you have the power to change somebody's life, like completely. And I don't take that lightly. I'm like, okay, what happened? Tell me exactly what happened. If you're truthful with me, we'll get through it. We'll work through it. If you're not, then you got to go. And anytime anyone ever comes and says, hey, I think I'm going to move on, I think I'm going to go somewhere else, I'm like, bye. You want to throw your party? We're in there like, you don't care? And I'm like, oh, I care, but I'd much rather you leave and be happy than stay here and make me miserable. Sorry. Sometimes the trash takes itself out. You did not hear me say that. There are days I'm like, okay, why are you so happy? Anyway, the thing is that no one, and I don't know about y'all, but when I became a manager, when I became director, no one gave me a handbook. No one gave me a class. No one told me anything. They were like, get after it. And I'm sure everyone here has felt the exact same way. And so this is where you have to pay attention to yourself and go, what is important to me? What am I conveying to these people? And I'm 100%, y'all set the tone. When you walk in, if I walked in here and I slammed that door open, slammed it closed, and I'm like, all right, I'm here to teach. What are y'all gonna do? You'll be like, okay. When I come in and I'm like, hey, y'all, I'm so excited to be here. Y'all, this is so much happier. The tone sets the mood. Then you're not in such a bad mood. And I will tell you that 90% of the time when I'm doing this and they're having a bad day or have some bad things to tell them, we go sit outside. We go stand outside in the sunshine, 5 minutes. I have a timer, 5 minutes. We go stand outside in the sunshine and we don't talk about work. We talk about, I don't know, my kid wrecked his car, didn't tell me. It had water. He had water collecting in his brake lights. And so, and once you become a human to these employees, and especially in the bigger departments, in the big departments where you are the head honcho and you have 120 people working below you, you are the most intimidating person in that hospital to them. They don't trust you. You're an authority figure. I am not in my hospital. And I don't mean that in a bad way. I just mean that any employee can walk up to me and be like, girl, I don't know what to do. I don't know where to go. I will help you. I never say it's not my job, ever, to anybody. I don't care who it is. It's not my job. I don't know. You want me to walk in your car? Let's go. It means I don't have to be in my office. I wander around a lot. So when you manage expectations, you can deliver exceptional results. You can deliver results that are going to be that way every single time that occurs. If you have a protocol, they know exactly what they're supposed to do. They know every time a lumbar puncture patient comes through, rolls through, and they're like, okay, I know I have this order. I have to get this ready for this doctor. And they're on it and ready. You are going to get the exceptional results that every patient experience person is looking for, because that patient goes, oh, they're on the ball. This is Chick-fil-A. This is Chick-fil-A. They're so excited. They're happy to see me because your employees are happy because you're happy. And so you have to sit and really have a good relationship with the managers that are teaching these employees. So it's not just you. You have to go, hey, you're head of CT. I'm going to need you to, or sit down. You and I need to go over a list of expectations of what I expect this person to be in 3 months, in 6 months. Where are they? And so you're not doing all the legwork yourself. You're having your leads do it. The leads are going to do it. They're going to be encouraged. Oh, she's taking notice of me. I'm doing a good job. And you always sit there, walk up to your managers. You are awesome. You are awesome today. I saw y'all did 110 patients out of the ER today. That was spectacular. And so then they have the confidence, and you have to tell your managers, these are the hospital's expectations, not yours. You are not self-appointed supervisor. These expectations come from the hospital. This is what we all do. And you have to practice what you preach. This is what we all do. And so that means you, that means your managers, that means anybody who walks in that department should act a certain way. And everybody knows it. And that's okay. You're not being gripey. You're not being territorial. They understand this is what is expected of me when I come and clean this floor, when I come and replace these ceiling tiles, when I come and do whatever, then I know I'm supposed to knock before I walk into an x-ray room. You know how many people don't know that? You know how many people don't understand what an MRI actually does? They're like, why is this pulling me? So everybody needs to have managers' expectations, and you need to give this to other directors. Everybody in your hospital should have a list of what the expectations are for walking into your department, because your department runs 100% differently than everyone else's department. And we have more visitors than any other department, honestly, besides nursing. They have everybody. But we have a lot of visitors. We have cath lab nurses coming through. We have regular nurses coming through with our stroke protocols. The EMS comes through. They have no idea how to act. They have no idea to shut their mouth. When you're talking about a patient, they can hear you, you know. So you have to give all the expectations to everybody. It's not just your employees. And my boss is the CEO. You think I gave him expectations? I expect this from you. This is what I expect from you. I know what you expect from me, but it goes both ways, buddy. Buddy. So, and then this is what ends up happening also. So workplace anxiety, confusion, and ambiguity. So that happens whenever you aren't clear. And when somebody says, I had one patient, she came in and she was like, she was one of my employees, and she's like, my daughter has cancer. I'm going to have to be gone every so often to do this. And I'm like, fine, good. Now, are you okay with me explaining that to everyone else in the department? You ask their permission and be like, hey, Melissa's going to be gone every Tuesday because of something, an obligation, something else. Whenever you need it, I will give it to you. You have to be fair in that way. Although you can also tell your employees, life's not fair. There's extenuating circumstances, especially Gen Z and millennials. You tell them, life's not always fair. This is extenuating circumstances. I pick the punishment. I pick the rules. Y'all do not. You follow them. That's just the way it is. But you can say it in a nice, friendly way. It doesn't have to be, you don't always have to be ugly. Clear and nice is also a way. It works. I've tried it. If you do actually give them great expectations, then your employee engagement is going to increase. And then I guarantee you, this will come after. And it will not just come after, it will be hot on its heels. And then your patient satisfaction is going to come up. Because now you have employees who are like, oh, I know exactly what I'm supposed to do here. We had a new protocol come through with lumbar punctures, and something to do with the specimen collection, it has to be in a special vial. And it was something for Alzheimer's. Brand new. We have had over 100 meetings on this. And it's an extra tube. And I was like, I get it. I get it. I understand. But the doctor's office doesn't understand it. So the doctor's office isn't putting it on the order. So we're not doing it. Who do you think gets yelled at? I get yelled at. And so I'm like, okay, we've had 400 meetings. Someone's not listening. Somebody's either not there, somebody's not listening. We need to sit back down and I want to see your eyeballs. Apparently Zoom is not working. 400 Zoom are not working. So we all got together. Everything works now. It's on the order. And I was like, I don't care. Make it look stupid for me. Put highlights, put flashing lights on it. I don't care. As long as it's there, we will do it all the time. And I will take responsibility if we don't, if it's on the order. But we all have to come together and agree this is what it looks like. This is the way it's going to do. And it's a lot of work for us. It's a lot of work for us to go, stop. I get it. I don't think everybody else here does. And sit down and write it down if you have to. Give them worksheets like I do. I'm like, here, this is what my expectations are. This is what we're not receiving. Have examples. Get ready. Like, get ready to fight because you have to defend your employee. You have to defend everything you do in that department. And you want your team to be correct in what they do. Because when you go up there, you're going to look like the dummy. Expectations. They're so much fun. And it's funny because I'm doing my PhD in psychology, and I've learned so much about the way people work and how important this actually is to a department. You wouldn't think, but what does good mean? What does that mean? I want you to have good x-rays. My definition of good, I guarantee you, is different than y'all's, 100%. What is terrible? You clip the apices. Some radiologists read it. I know two that will on my phone. Well, the patient was this, the patient was that. It's a pass fail. It's a pass fail. That means, and what happens when they clip the apices and they turn it in? That's a failure on my part because I did not explain to you what an actual x-ray should look like, what the hospital people demand, what the radiologists demand. So now it's my fault that happened. And now what am I going to do about it? How am I going to fix it? So we're going to go back. We're going to go back and be like, do you honestly think this was a good x-ray? Was this your mom? Was this your sister? They missed an infiltrate. They missed a whatever. They missed this. They have to understand and be aware of what the consequences are and what the expectations are from the radiologist. We know we can't get one radiologist to agree with the next. They won't even read each other's stuff. So you need to go and communicate with the radiologist and be like, okay, this is what they're going to be allowed to turn in. Because I had one radiologist, every lumbar spine, we had to stuff towels up underneath for the lateral to get it exactly perfect. And I'm like, but that's not the way the person looks. Like, we're fixing it to make it look textbook, but now you're misdiagnosing this because maybe that's what's wrong. She has too big of a curve. Well, if we straighten it out, who's going to know? Well, we wanted it to look like a textbook. Well, it does. That don't mean the patient's not hurting. So when you set expectations, you have to make sure you understand and everyone understands exactly what the definitions are. Dumb it down. Dumb it down. And be like, I know I'm not insulting y'all's intelligence because I will ask all the time, does that make sense? Not because I think you're dumb. It's because I talk nonsense quite often. And I don't know if anybody's listening or if anybody's actually going, what? Like, those words are English, but they didn't go together. I don't know what you mean. So You have to give good definitions, and you have to keep reiterating these definitions all the time, because we're all people. We're all human, and we're all going to have a bad day. We're all going to have an off day. And so then you're like, no, no, no. What does this mean? It was good enough. What if that was you? What if that was your loved one sitting on that table and it was good enough? And we clipped part of something. So what I like to do a whole lot is get with the team. I sit down with my team and I'm like, okay, we're doing CT today. What is wrong? What's your pits? What's your peaks? What are you facing? And there's some things, and I will tell them straight up, be honest. There's some things, this machine's a piece of crap, 100% agree. Ain't nothing we can do about that today. What can I fix? Well, we're not getting contrast like we're supposed to. I can fix that. I can fix things. Well, the patient was this, or our Velcro straps are old and they need to be fixed. We can fix that. Okay, now what kind of goals do you want to see for this department? There's 3 of them in my CT department. It's like, I want to go for ACR. That's what I want to do. And I'm like, done. You 3, get after it. I give you carte blanche, figure it out. And they're like, okay, yeah. Other ones are like, I just want to come, do my job, go home. You have workers like that. You need workers like that. It's okay. You don't have to have the one that comes in 15 minutes early, the one that stays 15 minutes late, the one that never takes lunch. Those are great. Everybody wants those, but you don't have to have them. The ones that are just doing the status quo is okay. They're actually great employees because they will always be there. They will always do exactly what they're told to do. And they are the ones that thrive on the expectations. They're like, I've got this. And I walk around my department and I'm like, what do you want to be when you grow up? You want to stay in X-ray forever? No. What do you want to do? I want to do CT. Let's hit it. Let's hit it. I'll give you 1 day off a week. You can go start doing CT. You can get paid for it. Really? Mm-hmm. I'll do that for you. You want to learn MRI? My nuclear medicine tech was bored. Bored. He learned MRI. He does MRI, CT, and nuclear medicine. That boy, I'm like, hey, would you come down here just for a little while? I know you're crawling the walls. Come on down. I'll give you something else to do. So people are looking for things to do. And when you walk through, I don't do huddle boards anymore. My dissertation is on huddle boards, and I don't like huddle boards. I don't do huddle boards anymore. I give my employees, hey, you're in charge of huddle boards from now on. This is the expectations. This is what they want from it. Go for it. And you have to be okay with letting them do it their way. Their way. If you're going to delegate, you have to be okay with going, it's yours. It may not be the way I did it, may not be the way I like it, but it has the elements there. It's yours. Let it evolve. Let your employees evolve into something else. Let them take those leadership roles. And first off, you'll be easier to walk around and talk to your employees and dance when you want to. I did a pirouette in the hallway the other day and fell. A pirouette? I was turning like this and my legs just kind of gave out. Boom, and I hit the ground and my friend was like, get up. I was like, you're fine. No, because I'm afraid my legs will give out then too. But I was definitely, like my 30-second dance parties, I come in all the time. But this is another thing. Do the goals feel reasonable and achievable? There are so many things that as leaders that we get thrown at you. They're like, we want every ERCT to be done within 30 minutes. Not gonna happen. Just telling you right now. We want every inpatient done within 45 minutes. It's not gonna happen. I have 4 techs on the floor. How am I gonna get everything done? I have 1 transporter. It's not gonna happen. And don't be afraid to say it. Don't be afraid to sell these bean counters. No, not gonna work. Let me tell you why. Let me show you why. Let's walk. It takes 5 minutes for me to get a patient from my lobby to an x-ray room. I've timed it. And I'm like, so you want everything done in 15 minutes? 10 of those are walking. So everything needs to be done in 5, and I'm supposed to give you excellent service? Yeah, it will be like a robot. Get on here, stand here, blah, 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 get out. So be prepared to have some fights and be prepared to say, you know what? Maybe this isn't achievable. Maybe it's okay. Okay, then what is achievable for y'all? What do you think you can do? And start slow. Start at 45 minutes. You know they can hit that time. You set them up for success, not failure. So then you sit there and you go 3-4 months, 45 minutes. Crushing it. They are doing 40 minutes. They are doing 38 minutes, crushing it. And you're like, awesome. Y'all are doing so good. We're going to do 3 more months of this, and then we're going to see if we can't move it up. Make them achievable and reasonable at all times. And I guarantee you, you're going to get a whole lot more flies with honey than with vinegar. And this makes it so they don't feel out of control. Because when they feel out of control is when they're defiant, when they do what they want, when they revert back to their old ways. Because they are mad and they're like, there is no way I'm going to get a patient done in 15 minutes. I'm not even going to try. And now I'm mad. Because now they're wanting me to be a robot. Now I'm mad. So come on, yeah. Oh, I know, it's so terrible. Get on the table, lay down. Because they have no motivation. Because they're already defeated before they even started. You have to be able to sit there and look at yourself and go, you know what? That was a little aggressive. Let's not do that. Let's go back and let's sit down. And when they're involved in these decisions, they feel so much more empowered. So much more empowered. And then, I don't know about y'all, but I hate this word. I hate it. It's a dirty word. So this means, as I told you, psychological safety. It's a comfortable environment for employees to give and receive feedback. This is where it comes from. This is where your trust comes from. If they don't feel safe, they don't feel like they can talk to you, they won't, and they will find a way to go around you. They will find a way to go around you. Somehow they will fake numbers. Oh yeah, I'm hitting this goal. See, because I don't know about y'all, but I work at Podunk, so everything is handwritten. So when they're doing turnaround times, I'm asking them to write down the time the order came, to write down the time they got it, to write down the time they finished. Now on the finished is in packs, but I'm making them do that. I'm making them do a whole nother extra step. For what? Why? Why are we doing this? Well, because our patient satisfaction scores suck. Oh, okay. Now I got it. Now I understand. So you have to make sure that you are respectful and that you give them the safety they need in order to understand why we're asking this of them, because it makes a difference. It makes a whole lot of difference, and it makes your life a whole lot easier when you do have this. So, purpose. We all have a purpose in life. Mine is to do as little as possible. I'm over being productive, but everybody has a purpose. Why did you get in here? Why are you doing CT? If you hate it, if you hate radiation therapy, if you hate being a transporter, that's when I corner my employees all the time. What are you doing? What are you doing? How's school? Why won't you go back to school? Well, it's too hard. Since when? Since when? I'll show you. I'll help you. You want to start learning x-rays? You're a transporter? Then you know what? For 4 hours a day, why don't you sit and you pick the modality you want to and you just work with them? You go transport patients still, but you also come and you watch them do the chest x-ray. You understand why. What makes you want to do this? Not because it's better money, because that's not an answer. It really isn't. We all are motivated by money. That's not your purpose. What is your purpose in this hospital? And if you don't want to be here, I will help you find a new job. I will help you. I just had one transporter. One of the two that have quit, he was going to be an operator in one of the plants. And he's like, you know, Kelsey, I just can't stay. And I'm like, go, please. I'll give you a letter of recommendation. please go follow your passion. It matters. It 100% matters. It matters for us. We have to have a passion of what we do. And if we don't, I mean, it's going to be a sad department. It's going to be an ugly department. It's not going to be a happy department. Nobody wants to fight all the time. I don't. I tell my husband all the time, I don't want to fight with you. I don't care. Just whatever. You want to eat? Fine, we'll eat. Whatever. So, this is the thing. You think progress looks like a straight line. It does not. You are going to have ups and downs. You are going to have all kinds of things, and you're going to have employees do stupid things. And when I'm telling you stupid, you're just like, what? You did what? Why? What were you thinking? Oh, I did this patient and it was a mammogram order, but I went ahead and did the back pain because that's what was. What? And you have to be forgiving. You have to sit there and go, okay, how do we fix this? How do we fix it? Not, oh my God, you're the dumbest person alive, because that comes through my head. It comes through my head every time. I'm like, what do you mean? What do you mean you quenched the MRI? What do you mean? What are you talking about? And so you have to sit there and okay, this was a setback, or they're not meeting your expectations. Let's back up. Why? Because I guarantee you, it will all come back to you. It will all come back to you. You didn't explain it. You didn't do something. You missed a crucial step in their decision making. And so then you have to look and be like, okay, if somebody's setting us back, are they doing it on purpose? Are they doing it just to get to you? Are they doing it because they don't really want to be here? They don't really care. They don't really buy in. That's when you can find your weakest links. That's when you can start pushing them out. Once you set the rules, that's how you get rid of your issues. And you don't have any kind of feet, like they have nothing. They have no legs to stand on. And when you come back and be like, oh, I quenched the magnet, well, you're fired. They'll come back, well, okay, well, did you train her not to quench the magnet? I didn't think I had to. I think that was, no, you have to. You're in the game of have tos now. Yes, sir. Of course, all the time. Okay. You're 100% fine. Yeah. Mm-hmm. The individual. Yeah. Or I'm not calling. I'm not calling them. I'm not calling to check on that. Oh yeah, yeah. Because it's 100% true. It's one of the three, and it always comes back to the leadership. So even if it isn't the individual, even if it is the person, why? Why is that person being defiant? What have you not given them to be a success? And it's a lesson. Like, I'm not telling y'all anything you don't know. I'm not telling y'all anything you don't know. But it's always good to come at it from a different angle and look at the bigger picture and be like, okay, so I have this problem. How am I going to fix it? Who am I going to get to help fix it? Am I going to get the person? Am I going to get, okay, we need to set a protocol. Like I'm waiting for this part. If I don't hear anything by day 2, I'm going to call. I'm going to follow up. I'm going to this. I'm going to that. Well, it's somebody else's department. It's the supply chain department. Fine. Call them. Call them. Tell you your expectations of them. Hey, I sent this 2 days ago. What's going on? I expected this to be done. I need this now. And again, if you explain yourself, they'll understand. They're like, oh, I didn't realize that the whole thing was down. I had 40 calls yesterday. Why is the MRI down? Why is the MRI down? Called the MRI. I was like, why is the MRI down? It's not down. The foot coil's down. They don't know what you do. They don't understand. The expectations weren't set. They have no idea what they're ordering. And so I go up once a year and teach the nurses, yo, I'm radiology. Hey, right here, this is how you order a radiology test. If you don't know, here's my number. Call me. Call me. Call Rebecca, my front desk person. Call somebody. Don't just put it in. We have no idea what you're asking for. We had one coming through in the nuclear medicine tech. Like I said, he's amazing. He's my little guy. He comes through and they ordered a bone scan on the bone paper in 208 instead of 207. He figured it out because he was like, and then he went to the doctor and was like, you did this wrong. Let me show you how to do this. And the doctor was like, oh my God. Oh my God. I did not realize that. I'm so sorry. They have to know what they're allowed to do, and they have to know that somebody behind them has teeth. You are back behind them and you have teeth. I will tear up, doctor. Come at me. Come at me. I'm always ready for doctors. Because I'm like, first off, you have no idea what you're talking about. So anyway, these are the questions you should ask yourself. Do I know what to expect? Can I describe when my expectation is being met or not? Is it reasonable or possible to expect that in any situation from any person? Those are the questions you first need to answer before you go and take your expectations to anyone else. Because you need to go, somebody came at me with this, what would I do with it? How would I do it? And me, being me, I'm a very vocal person. You are going to know if I'm unhappy. You are going to know if I am happy. That's just who I am. I have 40 employees who will not speak a word. They will come and they will talk, chit chat, whatever. But if anything goes wrong, they're in the corner going, because everybody's afraid for their job, except for me. I'm not afraid for my job. If I get fired tomorrow, I had a great run. It is what it is. And so I walk around the hospital saying exactly how I feel to most people, to most people all the time, because I know in my heart I'm doing a good job, but it is what it is. And if I'm not the right fit for that hospital anymore, that's okay. That's okay. I will move on. I will find the right fit, and they will move on too. I have no illusions that I'm irreplaceable. I know that. Most of the time I walk into a room and I think I'm the dumbest person in the room. I expect to be the dumbest person in the room. And usually I'll sit back and listen and be like, okay, I'm not the dumbest person. Awesome. Awesome. But my expectations are really low for me most of the time. I'm like, I'm the dumbest person that's walked in here. And then once you figure out what your expectations are going to be, then have I communicated that explanation to the other person? Have I asked them what they think I expect from them? This is a huge one. When you have a new employee, what do you expect? What are you getting out of this? What do you think I want from you? Does what they have told me about what I expect match my expectations? Am I practicing what I preach? If I walk in every day at 9 o'clock and I expect y'all to be there by 8, you don't do it. I practice what I preach because I have a 16-year-old who does what he wants. And then have they agreed that it's reasonable? That's the big thing. So again, if I walked in and I was like, You got 10 minutes to do every chest X-ray. I don't care. That's just it. And every time you don't do one, every time you do not meet this expectation, you're going to get written up. What would you do? I'd quit. I'd be like, yeah, okay. Or I'd be like, I haven't seen a rad applicant in 10 years. What is she going to do? She going to fire me? She needs me. And so you have to sit and you have to think to yourself, okay, is what I'm asking just, I want rainbows and puppies coming out of your butt every time I see you. That's unreasonable. I don't have rainbows and puppies. And so you have to really understand what you're looking for and pick these in a way that's not going to limit your employees to an extent where they don't want to be there anymore. And I know that sounds a little bit unreasonable because we're not here to make everybody happy, but you also have to understand that we have a department to run. We have to get through things. Some things just aren't negotiable. And when they understand, okay, this is why it's expected of me, this is what is expected of me, they can go out there and do it all day long for you. They will do it all day long for you. Maybe not every time at first, but it will become every time. And then it will become your culture. And then every person that comes in, you don't have to drill so hard because they've already got 14 people have already told me what they expect of me. 14 people have already told me, you have to do it this way. You have to do it this way. I'm almost done, I promise. Ooh. So then again, you have to look and see, okay, what am I supposed to do? How am I supposed to help you do that? Have they agreed that I accurately described the support they're asking for? So whenever somebody come in, they're like, our plate's broke, our DR plate's broke. What are you going to do about it? And you're like, I don't know. We'll call Biomed. Great, great. Our only DR room is down now because you're going to call Biomed. You're going to call them today. You're going to call them tomorrow. Are they off for President's Day like ours are? So you have to get them to agree to your expectations. If they don't, that's a good way to get them out. That's a good way to get your trash taken out. But if they do, then you have to be able to enforce that. You have to come back in and be like, you know what? I know I'm the happy person, but you did this wrong. This is your expectation. My expectations for when I discipline a patient, when I do that too. I do that too. When I discipline an employee, is my expectation is for them to be contrite. They know they quench the magnet. If I see that, I'm not ruining your life today. Like it's already it's done. It's already done. And B, what have you done before that makes me value you as your employee? Well, every time the 3 to 11 tech calls out, she stays over. That's worth something to me. You can quench the magnet. Not every day, but this one mistake you can get by with. You let somebody walk in with marbles. Because my thing, you fool me once, shame on you. It will never happen again. It will never, I will never make the same mistake twice. Except for food. I eat a lot of things I should. Anyway, but you have to make sure that you are willing to back up your expectations. You are willing and be reasonable. Be reasonable. I mean, I know we all get mad and I want to choke people literally on the highway daily, but I don't want to ruin anybody's life. I wouldn't want anybody to, because we've all done dumb things. I did dumb shit last night. We all do irresponsible, dumb things, but we don't want to lose our jobs over it. We don't want to have our careers ruined over it either. So again, when you're reasonable in making your expectations, also be reasonable in your punishments. You should not, and it shouldn't, the punishment should fit the crime, and it shouldn't be different from anyone else. Does that make sense? Like anybody who would quench the magnet, I would yell at them for a little while, and then I'd probably just be like, whatever. So this is it. I promise. I think this is the last one. Oh, yay! So again, I would sit there and I would have meetings at least every 3 months to go ahead and be like, what are we doing? What are we doing? How are we doing on these expectations? And let them speak freely. Be like, this is 100% safe zone. I don't care what you say. You can cuss me out if you'd like. Talk to me. What are you feeling? How are you thinking? What are you thinking? And let them actually say it. That's the trust. That's the psychological safety. Such a buzzword. Oh, I just die saying it. But that's what you are creating for your employees, and they will feel free to come and tell you things like, I accidentally quenched the magnet. I accidentally had somebody walk in with BBs, and you hit that immediately. You get that problem solved immediately instead of 4 years down the road when somebody has a BB stuck to them or your magnet stops working. So they will have enough trust to come to you and be like, look, dude, I just came over. I just ran over the ultrasound probe. So sorry. $17,000. Okay. But they came to me immediately instead of doing the subpar exams, because that's what they would have been doing, is subpar exams with